Christian McCaffrey was a full participant in Wednesday's practice, and then it was revealed that he was a limited participant in yesterday's practice. And finally, today, sources have revealed that he, in fact, did not practice today. And as of right now, he is questionable for the weekend. Sources are revealing that he is in fact dealing with a calf injury, and it's really important to know that when we are talking about the calf specifically, it's comprised of three specific muscles, and they are the gastrocnemius, the soleus, and the plantaris. Calf injuries are concerning because, as we know, as the calf muscles go down the back portion of the lower leg, they're going to come together and form that Achilles tendon, and we have seen time and time again that athletes that have pushed through calf injuries unfortunately sometimes end up with an Achilles tear. With today's video, I want to go over the specific anatomy of the calf. I want to also talk about the grading system when it comes to these calf injuries, and talk about a realistic time frame for McCaffrey to return to where we can see him play on the weekend. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I try to explain them so that they are a little bit easier to understand. I'll also talk about the relevant anatomy for that particular injury, as well as explain the rehab process. If you like this sort of content and you want to see more of it, please hit that thumbs up and subscribe to this channel, because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have dealt with a calf injury, go ahead and comment on your experience in the comment section below. One of the things that I like to do on my channel is look at the injury replay. Unfortunately, in this case, we don't have a specific injury replay, so I briefly want to talk about some of the things that can cause some of these calf injuries. The most common one that we'll see is any sort of explosive movements, whether that be running, jumping, or any sort of planting in the ground, as well as overuse. So if somebody is doing a lot of physical activity, they are doing a lot of sports, and they are essentially working that tissue to the point where it just cannot tolerate it, this can also predispose them to a calf injury. I briefly talked about the muscles that are located in the calf, but let's talk about them in a little bit more detail. The first muscle is known as that gastrocnemius muscle, and this is that big fat calf muscle that we often associate as being the calf. It's the one that's located most superficial, and this is actually going to cross the knee and the ankle joint. So you're going to see that this muscle plays a major role in flexion at the knee joint, as well as we see at the ankle joint itself. It's going to play a role in plantar flexion and dorsiflexion when we are going to be stretching that muscle. A muscle slightly deeper to this is the soleus muscle. This muscle does not cross the knee joint. So when we are talking about the soleus, usually what we're seeing here is that it's only going to affect movements at the foot and ankle. And so once again, once we flex that soleus muscle, it's going to plantar flex or point the toes downward, and doing the opposite of that, dorsiflexion is going to stretch it. And finally, we have the plantaris muscle, which is a very tiny muscle that is located in the back of the calf. So we've talked about some of the common causes of these calf injuries. A lot of times what we see in sort of these traumatic calf injuries is when a person is going to get an abnormal amount of stretch and or stress going through the calf. So we saw this with athletes in the past where they're being brought to the turf, the foot is planted into the turf, and when they're getting a lot of dorsiflexion going through there, that can lead also to a calf injury, as well as a full Achilles rupture. As of right now, we don't know which specific calf muscle is involved in this particular injury, but when it comes to calf injuries, the most common one that we see that is involved when it comes to this is going to be the gastrocnemius muscle. So that really big muscle we talked about earlier, specifically the medial head. So as I flip the model here, we have the medial portion of the leg here, and we have the lateral portion. The head that's often most associated with calf injuries, and I see this in the clinic in the non-athletic population as well, is going to be that medial head of the gastroc, because it is highly involved in these explosive movements, as well as it's going to take the brunt of a lot of the force when we are contracting the muscle in the lower leg. If we suspect that somebody has a calf muscle injury in the clinical setting, basically what we're going to do is, first of all, we're going to ask where that person's pain is specifically. And so most likely they're going to point towards that calf area. If we want to confirm that it is in fact a calf injury, what we're going to do is we're going to have that person perform the action of the specific muscle that we're testing. For example, because these muscles are all going to play a role at the ankle here, what we're going to do is we're going to have them perform a plantar flexion motion, and we're going to resist it, which is going to contract those muscles in the calf there. If this is painful and or weak, then this will make us believe that they are dealing with a calf injury. We can also try to differentiate between whether or not it is the gastroc and or one of the other two muscles, because once again, the gastroc is going to cross the knee. Because it crosses the knee and it plays a role in flexion, what we're going to do is have them bend their knee, and we're going to do almost like a resisted hamstring strengthening test right there. If that is positive, then once again, it makes us believe that it's specifically the gastroc, but it's sometimes really difficult to tell unless we have some advanced imaging, which of course is going to be the gold standard when diagnosing the specific injury. When it comes to the grading system of calf injuries, they are grades 1, 2, and 3. In a grade 1 calf injury, this is where we're getting some microscopic tearing of the affected muscle. However, it's not considered a partial torn muscle. In a grade 2, this is where we're getting a lot more tearing of the affected muscle, and it's considered a partial tear. And finally, in a grade 3, this is where we are considering this muscle to be fully ruptured, and it usually requires surgical intervention and is a very lengthy recovery time frame. Usually grade 3s and sometimes grade 2s are accompanied by a lot of swelling, bruising, and inflammation to the affected area. So this is something that we often look out for. And because you're getting more muscle tearing, a grade 2 is also pretty lengthy recovery time. Because in a grade 1, you're getting very microscopic tearing of the affected muscle, this is considered mild, and a person can miss anywhere from about 1 to 3 weeks. In a grade 2, because this is partial tearing of the muscle, this is considered moderate, and the person can miss anywhere from about 4 to 6 weeks. And finally, in a grade 3, this is considered severe, and this person can miss several months because surgical intervention usually is going to happen. As of right now, we don't know the severity of this calf injury, but what we do know is that as of right now, he is listed as questionable for the Seahawks for the weekend. So I can imagine that this is more along the lines of a grade 1 or a minor strain. We're going to have to wait and see if we get a little bit more details regarding Christian McCaffrey's case. We know last year that he was dealing with a calf injury and it led to Achilles tendonitis. Anytime you are dealing with a calf injury and it starts to affect the Achilles tendon, you once again really want to be careful with this because it can lead to a full Achilles rupture. We saw that this year a couple times in the NBA, and it's absolutely the worst case scenario. It's a many month upwards to over a year recovery time frame. So I highly doubt that the 49ers are going to make him push through this if this is anything more on the severe side. If we get somebody in the clinical setting that is dealing with a calf strain, first of all, if this is an acute injury, what we're going to do is we're going to try to perform that acronym RICE, where R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. Usually at the 1 week to about 10-day mark, we can start introducing gentle range of motion exercises to the affected muscle. A lot of times what responds really well to these calf injuries is if we introduce something called trigger point dry needling. I've done this a lot on my calf injury patients, and it usually does help speed up the process because a person that is dealing with a calf injury, it is very stiff and very difficult to move because everything is so tight from the injury. By using a trigger point dry needling technique, we are therefore lengthening the injured tissue, which gives it a little bit more space to heal more optimally. So if I happen to hear any more details regarding Christian McCaffrey's case in regards to this calf injury, I'll be sure to update everybody in the comment section. And if you happen to hear anything, please feel free to update us as well. So we wish Christian McCaffrey the best of luck moving forward regarding this calf injury. He missed quite a lot of time last season with it, and it ultimately led to him missing a significant amount of time. So hopefully this year, this is not the same case. Thank you so much again for watching my video today. If you enjoyed some of this content, then go ahead. I'm going to link one of my playlists so that you can watch some of the more content that I've talked about in the past. Thank you so much for tuning in, and I'll see you next time.